This PowerPoint contains few question and answer about the musculoskeletal system or disorder. The first question here, a client with a osteoarthritis asks for the information concerning activities and exercise. When assisting the client, which concept should be included? So when you read this question, you can see my patient has an osteoarthritis. It is also known as osteoarthrosis, shortly called OA. Osteoarthritis is the inflammation of one or more joints. It is the most common form of arthritis that is affect the joint in the hands or spine or knee, even in the hips. So, number one, the turn of the body when exercise is performed is not important. Number two, exercise in the evening before going to bed. Number three, exercising immediately upon awake allow the client to participate in activities when he has the greatest amount of energies. Number four, exercising at least 1 hour after a wake allow the client to participate in exercise after some of the morning related stiffness has subsided. The correct answer said number four, exercise at least 1 hour after a wake allow the client to participate in exercise after some of the morning related stiffness has subsided. So rationale said a client with the osteoarthritis has increased the stiffness in the morning upon awakening. Exercise should be scheduled at least 1 hour after awakening, and also exercising in the evening interfere with the client's ability to the rest at the bedtime. In this picture, we can see the healthy knee joint. This is articular cartilage. This is the meniscus and the space in between two joints, in between two bones. But in this picture, what is the osteoarthritis, we can see the degenerative change occurred in the meniscus, broken, and also cartilage are exposed to the bones. Same thing we can see here. This is the femur, this is the tibia and fibula, articular cartilage. But cartilage here, where patient has osteoarthritis, one cartilage. Here we can see the compare and contrast between osteoarthritis and rheumatoid arthritis. As I told you before, osteoarthritis is the inflammation, right? Inflammation of one or more joints in the body. But in rheumatoid arthritis, it is a chronic inflammatory disease that affects the joint. The result is painful joint, swelling of the joint, stiffness in the joint. What else? Osteoarthritis, more common over the 40 years of age. It is degenerative joint disease. Obesity, genetic predispositions, so positive family histories. Whereas the rheumatoid arthritis, as I told you, chronic inflammatory disease affect the joint. More common, patient 20 to 50 years of age. It is systemic disease. Unknown causes with exacerbation and remission. So sometimes it is chronic disease, sometimes acute attack occur, we call acute exacerbation of chronic disease. After the treatment or rest, disease will disappear. We call remission. Inflammation of the small joint, the hands, wrist, and feet are more common. Morning stiffness and joint decrease with activities. Whereas this osteoarthritis, we can see patient has a two characteristic feature. One is a Bouchard nodule and also Havender nodules present, right? So Bouchard nodules to the proximal joint, this one. But Havender's nodules around the distal phalangeal joints. In this picture, we can see this joint is called distal interphalanx joints. This is called proximal interphalanx joints. And this is metacarpophalangeal joints. And this one is a basal or first carpometaphalangeal joint. Distal interphalanx joints, this is the most common site for hand arthritis. And these joints may also develop fibrous bony nodules we call Havender's nodules. Proximal interphalangeal joints, these joints tends to stiffening and swollen from arthritis. And this may develop fibrous and bony nodules known as Bouchard nodules. Intercarpophalangeal joints, osteoarthritis here is uncommon. So if I go back here, we said the Bouchard nodules and Havender's nodules, right? So Havender's nodules, you can see a small fixed bump on the finger, usually at the last joint of the finger, the last joint in the finger. Havender's nodules is calcified screw of the joint, articular cartilage, a sign of osteoarthritis. So if I go back here, we can see osteoarthritis, weight-bearing joint get affected and pain increase with activities. But rheumatoid arthritis, pain reduce with activities. What are the treatment options? For osteoarthritis, non-steroidal anti-inflammatory medication is good. Muscle relaxant, immobilizations, cold pack, weight loss. What is the rheumatoid arthritis? We use aspirin, non-steroidal anti-inflammatory medications, NSAID. Steroid is very effective, or immunocompromised medication like adalimumab, Zumab, right? So next here, so what are the underlying cause of osteoarthritis? Maybe injuries or poor biomechanicals, eating inflammatory foods, and blood sugar imbalance. Also, chronic stress or poor sleep habit, environmental toxic exposure, chronic infections, vitamin D deficiency, right? Next question here. A nurse is caring for a client with a cast on his left arm after sustaining a fracture. Which assessment findings the most significant for this client? Number one, finger on left hand are swollen and cool. Presence of a normal popliteal pulse. Number three, cast edges are rough, tough, or skin irritated present. Number four, minimal pain in the left arm. So the key point is here, a patient has a broken left arm and you put the cast. If cast is too tight, cause the compression. If cast is too loose, it will not work. So in that case, what assessment finding most significant? Number one, finger on the left arm, because fracture in the left arm had swollen and cold, means indicate the nerve supply or blood supply is not work well. So when a patient have a cast, we have to check the neovascular examination. What is that? Neovascular assessment are performed to a patient to assess for adequate nerve supply and adequate blood supply is there, or blood circulation to part of the body. So neurovascular exam or this assessment are often performed when a patient has suffered any injuries or trauma or cast. And if patient has a broken hand or legs, we need the cast. Require a cast or have a restrictive bandage. So we have to check neurovascular assessment. Basically, neurovascular assessment contained 5 characteristics feature we shortly call 5Ps. P stand for we check for the pain. Then we have to check the pulse, distal, right? Distal arteries pulse, like posterior popliteal arteries or arteria dorsalis pedis. We will check the color, pallor. We look, is it white or pink? Also paresthesia, patient can feel it or not, or paralysis. Can you move the hands, legs, or distal part? The rational said swollen and cool finger on the left hand are the most significant assessment findings. They represent altered circulation to the hand caused by the cast. And normal radial or not popliteal, radial or popliteal, not popliteal, pulse should be present in the left arm. The popliteal pulse are found on the legs. Now, the skin irritation is an abnormal assessment findings, but it is not as significant as altered circulations. Minimal pain in the left arm is exposed. Next question. A client is diagnosed with gout. So, in case of gout, what we could see, which food should the nurse instruct the client to eat? Select all, right? Very important. NCLEX board asks that question from here. Green leafy vegetables, liver, cod, chocolate, sardine, and eggs. Select all. The correct answer is the Green leafy vegetables. Number 4, chocolate and eggs. So they said that which food should nurse instruct the client to eat, right? The question about the gout, sometimes it is called gouty arthritis. So the patient who have gout, they have elevated the uric acid level, and patient sometimes present with a low-grade fever, swelling the joint, or severe pain. Even patient develop the renal calculi. So decrease the purine in the diet, or purine reduced food like purine found in shellfish, liver, kidney, sweet bread, sardine, or other kind of food. So food that should avoid during the gout. Number 1, limited the intake of food that stimulates the production of uric acid. As I told you, in gout, elevated the uric acid level. Like fatty food, shellfish, meat, egg, caffeine. It increased the production of uric acid that is deposited in the joint and causes the pain. Number 2, during acute attack, white flour, yeast product like bread should be avoided. Do not consume leafy vegetables like cabbage, broccoli. So you see the question said, which food should the nurse instruct? Means some you should take or do not take. Not here. Number 4, avoid alcohol that increase the production of uric acid. And 5, keep away yourself from cake, pastries, and sugar. Rational say, client with gout should avoid the food that are high in purine, such as liver, cod oil, sardine, as well as the kidney, sweet bread, lentils, alcohol beverage, especially beer and wine. Green leafy vegetables, chocolate, eggs are not the high in purine and is acceptable food to eat. So next, it is same thing, look like bigger. Here we said a list of food. So if patient has a gout, the treatment option, we tell them go for the bed rest, right? Sometimes heat and cold therapy can work, and medication is we give colchicine or allopurinol. Also, alkaline acid diet used with the gout increase the uric acid level. So increase the pH, reduce the acidity of urine. The food to include milk, fruits except cranberries or prune. Most vegetables, small amount of beef and salmon. Acid as diet used with phosphate stone, increase calcium, decrease the pH, increase the acidity in the urine. Food to include cheese, egg, meat, fish, poultry, bread, cereal, whole grain, cranberries, corn, and legumes. Here we can see a very colorful, beautiful picture, 7 foods that prevent the gout. Cherries, pineapple, hot pepper, ginger, turmeric, water cress, and lemon. Here we can say food to eat and food to avoid with gout. What you should eat, you can eat low-fat dairy product, brown rice, dark berries, cherries, and carrots. You have to avoid salmon, tuna, liver, kidneys, and beer. In this picture, we can see the gouty arthritis here, right? Because of elevated uric acid and joint is swollen, the joint. Patient present with the pain. Next question about osteomyelitis. So a client with acute osteomyelitis is to receive parenteral penicillin for 4 to 6 weeks. Before administer the first dose, the nurse asks the client about known drug allergies. An allergy to which antibiotics or antibiotics class necessitated caution use of penicillin, right? Tetracycline, aminoglycoside, erythromycin, or cephalosporin. Answer is cephalosporin. Why? A client who has allergy to cephalosporin may also be allergic to penicillin. I want to read same sentence a different way. A client who has allergy to penicillin may also have allergy to cephalosporin. Both are correct. So if you see if you have a patient had a history of allergy to penicillin, better to not to give penicillin, not to give cephalosporin. If a patient has a history of cephalosporin hypersensitivity or allergic reaction, it is good not to give them cephalosporin and not to give them penicillin. For the same reason, penicillin must be used with caution in the client who are allergic to cephalosporin, glycoplovin, or penicillamine. The cross sensitivity between penicillin and tetracycline, aminoglycoside, and erythromycin has not observed. So in this picture, we can see infection of the bones. It is called osteomyelitis. So what is osteomyelitis? Bones infection caused by bacteria or fungi. Osteomyelitis may be spread from infected skin or infection from other part of the body. The patient who have osteomyelitis sometimes present with the bony bones pain, fever, swelling, redness, right? And treatment is antibiotics. Here we can see a very bad osteomyelitis, severe osteomyelitis in the jaw, right? Osteonecrosis occur in the jaws here. So we can see this picture, you see, bones and mandible is involved. So it is an infection of the bones caused by bacteria or fungi. Usually affected the long bones, arms or legs in children, and the spine even, or foot or feet among the adult. Common symptoms include fever, swelling, pain, redness around the infected areas. So how we diagnose it? Diagnosis include physical examination of the affected bones to check any tenderness or swelling. And the healthcare providers may suggest certain tests to confirm the diagnosis. And treatment option osteomyelitis include surgery to remove the infected bones and antibiotic to the control infections. Next question here. A client recently had a right total hip replacement as a result of intraoperative blood loss. Osteoporotic serum hemoglobin levels and hematocrit are low. Physical order 2 units of pegged red blood cells. During the infusion of the first unit of blood, the client developed a transfusion reaction and experienced urticarias, itching, and bronchospasm. The nurse discontinued the transfusion and notified physician. Which antihistamine does the nurse anticipate administering to treat this type 1 hypersensitivity reactions? Number 1, triphenylamine. Number 2, it is estramizole. Number 4, cyclisine. Number 4, chloramphenicol. Correct answer is number 4, chlorpheniramide. So Restaurant said the parental form of chlorpheniramide malate is used to relieve symptoms of anaphylactic reactions or allergic reactions to the blood transfusion or plasma transfusion. So when we advise the patient for blood transfusion, always make sure 2 RN supposed to be there. 1 RN check everything, 2nd RN do the cross-checking. After the blood transfusion, at least 15 minutes, the RN supposed to be with the patient to check for blood transfusion reaction. So blood transfusion, a procedure in which a patient intravenous receive the blood from a healthy donor. Usually during surgery or for other medical conditions, right? So blood transfusion, patient sometimes need to check for transfusion reaction, right? What is it is? Basically, hemolytic reaction occur, blood pressure drop, and respiratory rate go up. Patient present with the fever and chill and tachycardia will get. Also, patient present headache, chest pain, low back pain. Febrile conditions. Because of febrile, patient will be anxiety, or patient have tachycardia, tachypnea, and headache. Allergic reaction, we can see the facial flushing, rash, also itching or all over the bodies. So if we see any blood transfusion reaction, we immediately stop the blood transfusion and continue IV saline solution. So it is good always find out the risk factor before to start the blood transfusion. Always, what are the risks and complications of blood transfusion? So blood-borne infection like HIV, hepatitis are possible, right? To transmit, we have to check it first. Other reaction like graft versus host reaction also common. Delay hemolytic reaction or acute immune hemolytic reactions are also seen. Allergic reactions or anaphylactic reaction sometimes occur, right? We have to evaluate. Next question about the scleroderma. So when receiving a care plan for a client newly diagnosed with scleroderma, which nursing diagnosis has the highest priorities? So scleroderma means it is a group of disease causes the hardening and tightening of the skin and connective tissue, and it occurs due to overproduction of the protein called collagen in the skin tissues. Number one, risks for constipation. Number two, impaired skin integrity. Number four, imbalanced nutrition more than the body requirements. Number four, impaired gas exchange. Right answer is impaired skin integrity. As I told you, scleroderma, or it is also known as systemic sclerosis, a group of disease causes the hardening and tightening of the skin or connective tissue. It occurs due to the overproduction of protein we call collagen in the skin tissues. So impaired skin integrity. In this picture, we can see a few features: calcium deposit, puffy finger, Raynaud phenomenon, or digital ulcer on the scar. So impaired skin integrity is a common for client with the scleroderma in its early stages. Meticulous skin care is required to prevent the complication, although risks for constipations may also be appropriate. The nursing diagnosis is not the priorities. Constipation is not the priorities. The client with scleroderma are at the risk for imbalanced nutrition, less than the body requirements. The client with advanced scleroderma, not newly diagnosed scleroderma, is at the increased risk of development respiratory complications in the late stage, right? So how do we diagnose the scleroderma? So diagnosis of scleroderma could be difficult as it affects many areas of the body. And physician may order certain tests to confirm the diagnosis. And the treatment option, and basically there are no cure for scleroderma. The treatment aim at maintain the various symptoms associated with the condition. In some cases, the skin problem may resolve on their own in few years. So here we can see limited symptoms of scleroderma are referred as CREST, CREST. C stands for calcinosis, R stands for Raynaud phenomenon, E stands for esophageal dysfunction, S stands for sclerodactylitis, and T stands for telangiectasis. What is calcinosis? Calcium deposit in the skin, Raynaud phenomenon, spasm of the blood vessels in response to cold and stress, right? You see, esophageal dysfunction, acid reflux, and decrease in motility of esophagus. And sclerodactylitis, thickening and tightening of the skin of the finger and hands. Telangiectasis, dilatation of capillary causing the red marks and surface in the skin. What next? Next question here, a physician diagnose the primary osteoporosis, right? So osteoporosis here process in a client who has a lost bone mass. In this metabolic disorder, the rate of bone resorption accelerates with bone formation shows. Primary osteoporosis is the most common with elderly men, young children, young menstruational women, or elderly post-menopausal women, right? So out of the all, which one is your answer? Answer is the elderly post-menopausal women. So we can say the first picture, the normal bones, but here we can say osteoporosis bones. So osteoporosis, it is the deterioration of bones tissue or low bone mass. Here, osteoporosis leads to fracture of the vertebra, pelvis, and femur. The risk factor, sometimes hereditary or decreased physical activities, smoking, alcohol intake, low body weight, or low calcium diet, prolonged premenopausal or amenorrhea. So if a woman has amenorrhea before menopause, right, they have a chance to develop osteoporosis. Usually patient complain the back pain or pathological fracture is more common, also decrease the bone mass. And how we diagnose it? By bone density studies. Rationale said, although the cause of primary osteoporosis is unknown, an important contributing factor may be fourthly protein metabolism resulting from estrogen deficiency and a sedentary lifestyle. Typically, this condition occurs elderly post-menopausal women. So, what is the intervention, right? So, intervention are estrogen replacement therapy is good, or we prescribe patient to take bone viva. It is ibendronate medication for osteoporosis. Also, if your patient take bone viva or ibendronate, tell your patient take with a full glass of water, and also tell your patient on an empty stomach, or patient must remain upright for 30 minutes after the dose. High protein, high calcium, and high vitamin D containing diet is good to encourage them to intake. We also encouraging patient weight-bearing exercise like dancing, yoga, walking, bicycling, or swimming. It is good for them. So this is the few question and answer. If you practice from here, I strongly believe you will pass your licensing exam.